Stroke has always been a globally well-known disease. In Malaysia, stroke is listed to be the third most common cause of death. Based on the latest World Health Organization data published in 2020, the death toll caused by Malaysia reached a total of 21,592. This ranks Malaysia at 92 in the world rank for stroke deaths. Besides that, a database on hospital admissions from the Ministry of Health Hospitals showed that there was an increase in stroke cases in the age range of 35 to 39 years. The largest increase was 53.3% in men and 50.4% in women. There are multiple different causes of stroke according to the type of stroke that one experiences. For instance, ischemic stroke occurs due to blockages or narrowing in the arteries that provide blood supply to the brain. These blockages are caused by blood clots or fatty plaque deposits. Another example is hemorrhagic stroke, which is caused by leaky or burst arteries in the brain. This reduces the blood supply that can reach the brain tissue after the hemorrhage. In general, stroke is more likely to affect a person if they are overweight, are 55 years of age or older, have a family history of stroke, or have high blood pressure. A 2016 review from trusted source suggests that the risk of stroke mortality often increases due to age and demographic.
When I woke up, it was devastation. My name is Edward Cullen. I'm a 19-year-old student here in UiTM Dengkil and I am a stroke survivor. I mean, it was a really normal day. What I thought was a normal day, it was July 5th, 2020. I was getting ready for a badminton tournament at my school that day. At the time, I was a 15-year-old high school student at SNK Dengkil, excited to be participating in my school's sports festival. As a participant, I had already practiced weeks beforehand, so it was a shock when things took a drastic turn. I remember stretching near the badminton court when I felt the sensation immediately that I was getting weak and felt that I was losing my strength, specifically on the left side of my body. So when that happened, I recognized pretty quick it was something very serious. I immediately sat down and turned to my friends and mentioned to them something serious had just happened to me. At that point, I lost the ability to talk. There were many people around me witnessing this incident. The teachers around me rushed to my aid and somehow knew it was likely a stroke. I was still in shock as I thought that I was in perfect health. In fact, I even worked out on the weekends.
It all happened so fast. Looking back now, there were definitely symptoms that I may have missed since I was pretty uneducated on stroke. One of them was that his face grew and he seemed to find it difficult to communicate. He also got very weak and suddenly lacked coordination.
Edwin Cullen case was unique. There's only a handful of cases you usually remember your entire career, and his is going to be one of them for me because it was actually my first time seeing a stroke case. When he came in, he immediately went into one of our resuscitation bays. You could tell that he could understand what we were saying, but he could not form any type of logical responses to what we were asking him. This part was really concerning to me, along with his agitation and how he was refusing care, which made me think he wasn't his usual self. He was refusing the nurses attending him, so we couldn't give him an ID. So we had to sedate him. We also gave him a breathing tube and put him on ventilator. Afterwards, we gave him a CT scan, which is the best way to identify a stroke syndrome.
As soon as I arrived at the emergency unit, I was escorted directly to the stroke unit. One of the first decisions that I needed to make when I arrived at the ER was to sign off to put my nephew in a medically induced coma. It was a very scary situation, but reflecting back on that time, I'm so very grateful for their professionalism and the way they communicated with me. And they took quite a bit of time to show me and talk to me about the result of the CT scans and what it would look like to be his next step towards recovery.
After that incident, I did a bit of reading on stroke as I wanted to understand more about my friend's condition. Apparently, there is a timeline for after stroke. After a stroke occurs, within the first 24 hours, it is called a hyperacute phase. After about a week, it is then labeled as acute. A couple months later, it will then be called early subacute and is called late subacute for 6 months after. Lastly, for 6 months onward, it is simply called a chronic phase. These are all stages of stroke within a stroke chronology.
Edward had an unknown and newly diagnosed clotting condition called antiphospholipid antibody syndrome, which causes clots to form really anywhere in the body. And he had a clot formed in an artery inside the brain and causes his stroke. Overall, he looked to be in a very poor neurological condition.
When I woke up, I wanted to communicate with my uncle. I wanted to communicate with the doctors. I wanted to ask questions and answer them, but I couldn't communicate. It was gibberish that came out of my mouth, and I tried to communicate and write, but couldn't. The only thing that went on the piece of paper was literally just a line. It was incredibly frustrating. My ability to communicate in speech was at a level of maybe a kindergartner.
Edward had what we call is an expressive aphasia. He was able to comprehend and he was able to follow command, but he was unable to express himself and allow people to understand what he was thinking and what he needed.
Well, emotionally, it was devastation for me. I mean it really was. I think every stroke patient is going to have some varying degree of depression. You start to realize that this isn't like breaking a bone. Recovery is going to take time. So if you don't have some sort of support system in place, that's where the depression comes in.
It was heartbreaking to see Edward in such a weakened state. Most days, it was so hard to keep it together. As someone who has no medical knowledge, it seemed to me that he was never going to get better. But being his only guardian, I kept the optimism going despite my own belief that all hope was lost.
Rehab plays such an important role for stroke treatment, especially in the beginning recovery stage. When Edward came to rehab and when he first saw me for speech therapy, he had a pretty severe aphasia. He was unable to read, he was unable to write. So we would practice naming pictures and describing photos. Stroke patients require intensive therapy daily, 7 days a week in order to recover from their stroke. However, other types of stroke require a more complicated treatment. For instance, ischemic stroke is treated through a thrombectomy procedure to remove the clot from blood vessels. The surgeon will put a long flexible tube called a catheter into your upper thigh and thread it to the blood artery in your neck or brain. While treating a hemorrhagic stroke involves aneurysm clipping, which blocks off the aneurysm from the blood vessels in the brain. This surgery helps stop bleeding caused from the aneurysm.
An activity I did that was a part of the treatment was that a doctor would show up daily and show me an object. One of the objects they showed me was a paperclip, and I didn't know what it was. I could see it, I understood what it was used for, I just couldn't communicate to you. 2 weeks. That was how long it took for me to finally say the word paperclip. Even though it was weeks of frustration, when I finally managed to get the words out, it was clear to me that I could come back.
It was inspiring to see Edward going from gibberish to forming a full sentence within a couple weeks. Occasionally, I would join him for rehab sessions. The doctors said it would help to create a more informal environment so that speech may form naturally. I was glad to be there and help in any way that I can.
Stroke is a truly devastating incident. There is no way to completely be safe from stroke, but there are certainly precautions that can be taken. One of them is maintaining a stable blood pressure, as high blood pressure is a huge factor that doubles or even quadruple your stroke risk if it is not controlled. Besides that, individuals with diabetes must treat them as soon as possible, as having high blood sugar damage blood vessels. Over time, making clots are more likely to form inside them. Last but not least, the universal precaution for most diseases, which is to simply exercise more. When you exercise, reach the level at which you are breathing hard, but you can still talk, even if you don't have 30 consecutive minutes to exercise. Break it up into 10 to 15 minute session a few times each day. After all, it's better to be safe than sorry.
The compassion that I was given was instrumental to me being here today. To date, I still keep that paperclip. This paperclip symbolizes hope that I am able to communicate back with the world. I'm talking right now and communicating with you. I'm here and I was able to overcome it. My name is Edward Cullen. I'm a survivor of a stroke.